How do you teach vocational sanitation in school complex? It is the policy of practice of protecting health through hygienic measures. First one, training the teachers. Important to improve good hygiene. Brings cleanliness and good habits in child. Brings good foundation of cleanliness. Easy to adapt in life. Start from Anganwadi workers. Second one, involving children. They learn the value of food hygiene. Learn it from classroom and peer education. Third one, water sanitation and hygiene in school initiative, popularly called as WAS. Concentrating toilet and washing hands reduce diarrhea around 40%. Make children understand through activities. For example, child cabinet easily reach children. Water facility for coverage 93%, for functional 70%. Children suffer, mainly adolescent girls, due to improper sanitation. They drop school. Poor hygiene leads to illness. In schools, around 6.5 million children have no water. Around 28 million children have no toilets. Only 1 in 10 schools have soap facilities. Fourth one, reach every student. WAS program. Reach all children, improve their health, increases attendance and cognitive development, brings gender equality. This has to be achieved. This prevents the children from communicable diseases. Midday meals scheme, good opportunity for daily washing hands. Hand wash activity performed in group, monitor daily. VLF, village level facilitator, helps the teachers in schools. Funds allotted from village level Panchayat program. MHOD, complete commitment. Fifth one, involving community. Involve community through competitions for students, for example, poster contest. Students teach parents. Local authorities ensure facilities and maintenance. Example, hand pump, overhead head tank in schools, etc. Personal hygiene. Fifth one, teach adolescent girl child disposal of sanitary napkin. Keep incinerators in schools for disposal. Last one, address the problems. Even now, 6 out of 10 schools only have toilets. Other in open defecation. Healthy hygiene habits at school. Helping to keep your children healthy at school through good hygiene. Whether your child is starting school for the first time or returning after the holidays, mixing with lots of other children will expose him or her to many more. Cannot prevent contact with all germs. And remember that exposure to germs is a good thing. You can help reduce the risk of your child picking up an infection through healthy hygiene habits. How do germs spread at school? School children often pick up cold and flu virus that can lead to diarrhea. These infections can spread very quickly from child to child by touching a contaminated surface. Germs also spread very quickly in the air via coughs and sneezes, as well as by eating contaminated food. Why is good hygiene important? Once your child becomes infected, germs can quickly spread to the rest of your family at home. Both of the common cold and upset tummies are common at the start of a new term, both in schools and families. So, helping your child understand about your good hygiene will go a long way to helping them and the rest of your family stay healthy. Avoid spreading cold and flu virus. Although vaccinations can protect your child from some serious disease such as tetanus, diphtheria, and whooping cough, infection cannot protect children from every type of harmful bacteria. Top tips of good school hygiene. Keep hands clean. First one. Through hand washing is the single most effective way to help prevent the spread of infections in school. Teach your children how and when to wash their hands. Rubbing the hands together for at least 20 seconds using soap and clean running water. Always wash hands after using the toilet, before eating, after playing outside, after touching something dirty, after coughing, sneezing, or blowing their nose, after touching a dirty tissue, after petting, stroking animals. Whenever hands look dirty, put a pack of sanitizer in your child's bag or lunch bag so that they remember to use it before eating. Coughs and sneezes spread diseases. Teach your children to cover their nose and mouth with the tissue when coughing or sneezing to stop germs from becoming airborne. Throw used tissues in a bin and always wash hands with soap and water afterwards. If there is not tissue available, encourage your child to sneeze or cough into the crook of their elbow instead of their hands to reduce the spread of bacteria. Third one, healthy diet. Whatever your child has, a packed lunch or a school dinner, a varied and balanced diet will help protect their health and promote proper growth and development. Eating properly also aids concentration during lessons. Preparing a packed lunch. Make sure you wash and dry your hands before you start making a packed lunch. Your kitchen surfaces should also be clean and disinfected. Then check all foods are within their best before dates. Use an airtight rigid lunchbox that is washed and dried before and after use. Wash fruit, salad and vegetables thoroughly in fresh clean water. Try to prepare food fresh each day, as there will be less opportunity for germs to grow. Fourth one, drink plenty of water. Water is much healthier than drinks that are high in sugar, sweetness, additives and caffeine. Encourage your child to drink plenty of water throughout the day, as even slight dehydration can lead to poor concentration, lethargy, irritability, and headaches. Dealing with illness. If your child is unwell, keep them away from school until they are fully recovered and feel able to join in. If they come back too early, they risk spreading their germs to other children. As a rough guide, keep children away from school when suffering from the following infection disease: chickenpox for 5 days after the rash appears, vomiting and diarrhea until 48 hours after the last episode of vomiting or diarrhea, the flu until completely recovered, measles for 4 days after the rash appears, bacterial meningitis until completely recovered. How you can help? As well as encouraging good hygiene in children, you can also help prevent the spread of germs in school by following these basic steps. Keep school bags clean and free from food remnants, especially if your child carries a packed lunch to school. Gym clothes should be brought home once a week for washing. Make sure your children change their socks and underwear daily. Wash school uniforms on a high temperature to kill bacteria. Good hygiene in education. Teaching children to understand the importance of hygiene is an essential part of their education. With their less developed immune systems, infections are more easily caught. School life can be frequently disturbed by the spread of communicable diseases such as influenza, noroviruses, and Ebola. Hand hygiene really helps reduce the spread of germs. Research shows that improper hand washing can cost the education system millions of sick days for students and staff. Hand washing is the most important thing you can do to keep from getting sick. washrooms. Improving the conditions of the school washrooms and providing adequate facilities supports increased hand washing rates and more positive attitudes in students. The simple act of washing hand reduces the risk of stomach bugs by as much as 47%. Risk hotspots within the washroom include toilets, flush handles, cubicle handles, and areas around the sink. The use of color throughout the washroom and colored dispensers can enhance the experience and encourage hand washing. Effective hand washing and drying is critical to disrupt the spread of germs. Ensure soap and hand drying provisions are well stocked. Provide hand washing demonstrations to students and equip washrooms with signage and visual prompts to promote good hygiene practices. Canteens. Food hygiene and safety are critical in ensuring children's well-being and maintaining educational standards, keeping both staff and students safe from foodborne illnesses. Train staff on correct hand washing procedures and glove usage policies to minimize the spread of germs from hands to food and surfaces. Ensure adequate hand washing facilities are provided and well stocked, including soap, paper or linen towels, and waste bins. Clean food preparation areas and disinfect work surfaces regularly to reduce the risk of cross contamination. Classroom. An unclean classroom creates a breeding ground for harmful bacteria affecting both children and staff. Incorporating hygiene education in the curriculum and can boost hygiene standards. Door handles and common surfaces are often overlooked when cleaning. Ensure a good cleaning program and provide access to hand sanitizers to minimize the risk of cross contamination. Reduce your school's carbon footprint with the provision to automated taps that reduce water consumption, particularly in science classrooms.